So the companies, when they made this sort of gold rush in 1989 to add new vaccines to the schedule, took advantage of that and said, hey, we don't have to safety test these things. And because of that, we now have products that nobody knows what the risks are. We do know that the same year that we passed all of that, they put them on the schedule, you had this explosion of chronic disease. And, our children are now the sickest generation in history. And CDC shrugs its shoulders and say, if you say, where's this autism epidemic coming from? They say, we don't know.
Right.
Where is the obesity epidemic coming from? Where is the diabetes epidemic coming from? Why do our kids have peanut allergies, which essentially didn't exist prior to 1989?
How about all the attention deficit stuff?
Yeah, and all of that
as
is
well
directly linked to vaccines in the scientific literature. On our website, we have 1,400 studies, peer-reviewed studies, published on NIH's website, PubMed, linking it to linking various vaccines to all of those injuries.
So what are they doing this for, money?
Well, they're making $60 billion a year selling us vaccines, but they're making $500 billion a year selling the remedies for the injuries caused by vaccines.
Wow.
So the diabetes medication, the Adderall, the Ritalin, the Concerta, the Advair inhalers, the albuterol inhalers, the anti-seizure medications, all of those, this is a really great business plan for these companies. You make people sick, and then you sell them the lifetime cure. Measles, they weren't making any money. If you get measles or chicken pox, the cure is chicken soup and vitamin A, and you can't patent either of those.
Huh.
And you're well in a week. There's self-limiting illnesses that go away in a week. But if you can give somebody that vaccine and make them, diabetic for life, and you got a permanent customer, or ADD or ADHD, and many of the vaccines are for illnesses for which there's zero risk. A 1-day-old baby has zero risk of getting hepatitis B
right.
if his mother doesn't have it,
yeah.
which every mother is tested for. You can only get it from, unprotected sex or from sharing needles. So, why are we giving 1-day-old babies a vaccine for hepatitis B, and they admit the vaccine only lasts 5 years? That baby is not going to have sex with a prostitute in the first 5 years of life. There's zero risk. And yet it's a very, very dangerous vaccine. And I'm not anti-vaccine. I'm very,
Right.
I just want safe vaccines. I want vaccines tested. And what I've said to people is, test them against an inert placebo, not one of them has ever been, or test them against an unvaccinated population. So show me a vaccinated population and an unvaccinated population, and show me that the vaccinated population is healthier. And if you can do that, I will post that study on my website, and I will retire from this work and go back to working for a waterkeeper full-time, which is what I want to be doing.